So this is a very tricky, interesting case also for a congenital malformation on a young child. We have 50 dBA bone gap on the right side. It's a unilateral hearing loss, stable with time, since birth. So this is a right ear, so this is 12 o'clock, 3 o'clock, 6 and 9. And what you can see, of course, is that we have a really narrow canal, 3.5 millimeter speculum, which is even too big. So the only way for me to see if I can do something is to try to do a little bit of a canalplasty to increase the size and see how we can work on that in a very narrow environment like this. So you see I made an incision like this, and I'm elevating the flap, and I will start by drilling out the bony canal wall at the level of 6 o'clock. Donnez-moi le lancer au lait encore. The problem is that I cannot even use a regular instrument to elevate the flap because it's too narrow. The first thing that I want to do is to enlarge a little bit the elevation here of the flap inferiorly in order to have access to the bone in a better way, in order to drill out the bony canal wall. And I will see if I can do something after having drilled out and enlarged a little bit the canal. Donnez-moi une petite lame là. Ah, c'est trop gros ça. C'est la moitié. Oui. Ouais. Voilà, donc ça c'est donc situation difficile d'une malformation où il faut essayer d'élargir le conduit pour voir si on peut accéder à l'oreille moyenne et voir le type de malformation clairement et voir si on peut faire quelque chose en fait. Donc pour l'instant j'ai décollé la peau du conduit pour essayer d'élargir le conduit. Calmez. Je vais prendre une toute petite fraise hein, là. Pince.
Tu as des 8 et des 10.
Flaron, s'il vous plaît, s'il passe. Ok. Je vais voir la plus petite, c'est combien là que vous avez? Ah, c'est un poil gros ça, je pense que vous avez plus petit. Ouais, ok. Okay, so we're going to start drilling out the bony canal wall inferiorly. I need a little bit of space, more space, to have the possibility to even move my instruments within the middle ear cleft. C'est la plus petite celle-là? Ouais, donnez-moi la 8. Hein. So of course we have a facial nerve monitoring because in this congenital malformation there's always some traps. Donnez-moi la 10 pour voir là. Voilà, on a un spéculum qui fait 3 mm et demi, hein, donc c'est vraiment la limite de ce qu'on peut faire. Donc on opère dans une ouverture de 3 mm et demi là. Et bouché. Non, c'est direct. So it's starting to be a little bit better because you see that the instrument is going deeper in the field. Of course, what I want to see here is the level of the annulus. So I can drill out more inferiorly here. Après encore. It will be a long-term drilling out procedure, of course, for the ear canal. Because I will do something only when we will have access to the clear and safe access to the annulus and the middle ear cleft. Lancez-le direct. La fraise encore. Lancez-le direct, s'il vous plaît. La fraise encore. So I'm drilling at 6 o'clock at the moment. I'm pretty close to be able to expose the annulus, I think, at that level. Alors, si vous voulez, direct encore. Calmez. C'est bouché, je pense. So of course now I use a needle. That's the only instrument I can use at the moment to elevate the adenoid if I can have access to it. Un peu petit s'il vous plaît. So you understand that I'm trying to identify at the moment the adenoids. And I'm elevating the flap, and we have some bone here, which I think I can remove later. I think I'm entering the middle ear cleft here at the level of 6 o'clock. Yeah, definitely. I am inside the middle ear. You can see there. So I will be able to remove this, which will allow me to have a better view. La fraise encore. Ok, alors donnez-moi maintenant le crochet à os pour voir. So I will use a hook first to determine the thickness of this plaque. It's not so thick. You can see that I can remove it with the hook, which helps me a lot, rather than using a macro drill maybe in this case, maybe to finish the job. Yeah, I need it. Bon, donnez-moi la fraise. Oh, donnez-moi la plus petite alors là. I'm going to use la 6. I'm going to use 0.6 millimeter diameter burr now. Bouché, je pense. Of course, when I put the burr in the field, I can't really see what I'm doing, so it's very important to determine the landmarks of the bone, I mean, the level of the bone, and then you can drill out step by step. Okay, now it is much better. Alright, good. So I've already elevated the inferior part of the flap at the level of 6 o'clock. So now I need to know if I can elevate the flap from 6 to 12. Donnez-moi le cadenas, s'il vous plaît. Ça, faut que je vois. I'll put back the flap and I see if I can do it now superiorly. Alors le lancer au lait direct. Cannelez s'il vous plaît. This is larger. I mean the stenosis of the canal, the fact that this canal is very narrow is more superiorly, I mean proximal, I mean the proximal part of the canal is very narrow. And then once we have passed this, I think it will become much better. Donnez-moi les ciseaux, s'il vous plaît. The problem is that we have a very thick skin at that level. Vous avez un autre, s'il vous plaît. Cannelez. Ciseaux. There we go. Now I can continue elevating the flap superiorly. We need to follow the bone, have contact with the bone all the time with the needle. Calmez encore. So this might be the cord tympani, but it's going to be very tricky to preserve it, of course. Looks like. I'm not sure about that. We'll see later. We have a little bit of bone here again. Kind of plaque. And I'm going to join now the inferior elevation, but I have to remove this bone for sure. Now I'm entering the middle ear cleft. This is the mucosa. Okay, all right. Still very narrow, as you can see. Cannelez. So I have to expose now the ossicular chain, of course. At the moment, I'm not even sure that I can do something, but I'll have to expose. big, you can see here the cord tympani here. Cannelez encore s'il vous plaît. Je vais voir si la gouge passe, ça m'étonnerait. C'est trop gros ça, je pense. Ouais, c'est trop gros. Bon, donnez-moi la fraise. Alors, attendez, je vais essayer de récupérer la lame. Cannelez d'abord. I will enlarge the posterior part of the canal now at that level, trying to increase the size. All right. Un plus gros là, s'il vous plaît. Un 8. Of course, the most important thing will be to identify the facial nerve. I think we are over the round window niche, which I can see below here. So it's important to determine the different landmarks step by step. There we go. Now I think we have a better exposure of this area. All right, ok. Mettez la tête en déclive s'il vous plaît. Stop. Cannelez. Now I'm working from 9 o'clock to 12 o'clock. Donnez-moi la pince s'il vous plaît. I will remove temporarily the Silastic sheet. Cannelez. So, what I can recognize at the moment is the promontory here and the round window niche on the right. That's all I can see. I don't have access to the ossicular chain yet, so I need to move more. Cannelez encore. This is the quarter tympani, right in the middle of the field. I really don't know how I'll be able to preserve it because it's just too narrow at the moment. Because I need to remove this bone here, which is right underneath the quarter tympani. Because the only way for me to expose the ossicular chain is to remove this bone. Ciseaux. Ciseaux, ciseaux. Cannelé. Well, the problem is that I cannot really change the position of the chordae tympani here. This should be removed, of course, and then I think I will be able to expose the ossicular chain. Cannelé encore. Alors, donnez-moi le crochet out, s'il vous plaît. So I tried to see if with the hook I could do something. I don't think so. It seems to be thicker than the inferior one. And also the problem is that I don't have access to the ossicular chain, so I don't know where is the incus and the stapes and everything, so it's difficult to put something below this bone here. Okay. Cannelé. Crochet aussi. Plein rond, s'il vous plaît. Cannelé. Donnez-moi la lame de Silastic. Okay, I will try to drill out this bone here now. La 6, s'il vous plaît. Non, la 6, la 6. Donnez-moi la 8 maintenant, s'il vous plaît. Cannelé. Faut pas trop arroser là parce que sinon... Remettez-moi la 6 du coup. Crochet house. I just want to identify the ossicular chain. This is what I'm trying to do first. So at the moment, as you can see, I don't even see any ossicular chain. Oh, there we go. I think I can see something. Yes, now we can see the ossicular chain. Here, right here. Tête en déclive encore, s'il vous plaît. Stop. Cannelé. Yeah, we can see the incus and probably the stapes head. This is the incus and the stapes head. And if I move, there's no movement here. Yeah, there is a movement, so we will see. Anyway. La fraise encore. Probably we have a malformation of the stapes. That's what I think, but we need to determine that. La 6 maintenant. C'est la 6, hein? So of course I need to drill out more the bone here to uncover more or to expose more the incudiostapelar joint in order to check the stapes mobility then. Je vais prendre une 8 maintenant à nouveau. Of course, you can imagine that I cannot use the curette, which I like to use usually, but not in this case. Too small. C'est bouché. Crochet à hausse, s'il vous plaît. Allez, la fraise encore. Now, step by step, you can see that you can see better slightly better the stapes. Calmez, s'il vous plaît. I try to preserve the skin here, but it's so narrow that the burr is coming in the middle, of course. Ok, la fraise pour voir. Okay. Okay, let's see now back to the ossicular chain. Calmez, s'il vous plaît. Passe, passe. Okay. Calmez. Now we have a better exposure of the ossicular chain, so I will be soon able to check malleus, incus and stapes mobility. Everything seems to be mobile, but at the moment I don't have access to the footplate. Could be the problem, and in this case, because I've seen cases where there is a malformation of the stapes superstructure which is not connected to the footplate. And if it is the case, we need to be very cautious about the facial nerve, because I've seen several cases like this where we have a malposition of the facial nerve. Un œuf, s'il vous plaît. C'est un œuf? Crochet à os. Trois de chouk. Okay, allez, redonnez-moi la lame de Silastic, s'il vous plaît. What I need to do is to identify the facial nerve. Pardon, 3 de chouk d'abord. Okay, donnez-moi une lame de Silastic. Okay, I will try to enlarge a little bit the drilling out to my left. Calmez, in order to expose the fallopian canal. At the moment I don't see any malposition of the facial nerve, especially on the promontory, but I need to check later again. This is the incus, and this is the stapes head. La fraise, s'il vous plaît. La 6, c'est la 6 ça?
La 8.
Ouais, je me la faut la 6. Non, non, n'arrosez pas trop là. Calmez s'il vous plaît.
Ça va? Vous avez tout, s'il vous plaît.
Calmez s'il vous plaît. Je peux pas vous dire. Ah, je suis désolé, mais c'est pas du tout une technique habituelle, hein, ça. Enfin, la technique, oui, mais c'est une malformation complexe. So we can see now the fallopian canal on the left. This is the facial nerve here. So this is fine. I have a better exposure now, which is much, much better. Okay, good. I think that's enough for me. So I will need now to check the stapes. Calmez, s'il vous plaît. Stapes looks mobile. If you can see that if I check the stapes, it looks mobile, but I'm not sure. So it's interesting to expose completely the ossicular chain, and also the malleus incus are mobile. You see I'm moving the malleus and the incus is following the movement. So at the moment I don't see any anatomical situation. So I don't know, I need to continue. 3 dessous. I just need to expose the footplate to see if the superstructure is connected to the footplate, which I do think, because I don't see any problem on the promontory here. All right. I have another fibrous tissue here. All right, that's good. Set, s'il vous plaît. I'm going to check now the footplate. So it's very dark, of course, but I cannot do better than this, for sure. So you see the footplate. So now what I'm going to do, I'm going to move the stapes, and we're going to see if the footplate is following the movement or not. Calmez. Yes, it's completely mobile. So there's no other way to do it rather than leaving it like this, because I don't see any ossicular chain problem. So we have exposed the complete ossicular chain without finding any problem. Malleus incus are both mobile, and stape is also mobile. So it could be a malformation inside the inner ear, but there was no other way to determine that. You can see here it's perfectly mobile. The footplate is fluid, and there is no problem between the incus and the stapes. Check that. Here the joint. Joint is there and preserved. Yeah, there's no problem with that. Of course, I can try to check the round window, but it's difficult to have access to the round window, which is deeper here in the right. The round window must be here, and I don't have access to on the right here, but I don't have access to that. So anyway, I don't see any ossicular chain issue, so that's the only thing I can do, unfortunately. So I'm not sure there will be any improvement, of course, because I didn't see anything. Calmez. Alright, so that I think we need to stop, because the exposure was fine and showing nothing. So I'm going to remove now the Silastic sheet. On va préparer un aérosol après. Hein? On va le tailler parce que ça sera pas là. Okay, now we will reposition the flap. Calmez. But I'm pretty surprised by the position of the of the tympanic membrane, which seems to be lateralized. Let me see about that. Can we? Maybe there's no connection between the malleus and the tympanic membrane. It's very strange, but it's very lateralized. I don't really see any connection there, so maybe what we can try to do is to put some prosthesis there, because the malleus is there. Yeah, I can see what's happening. We have a really small malleus. Can we? I cannot expose the annulus, but I can feel it. Can we? Yeah. This is the malformation of the malleus. So that's different. Candy. The problem is still there because it's so narrow. Okay, the only thing I can try to do, because I think there is no connection between the tympanic membrane and the malleus, and I don't have access to the malleus at the moment. So what I will do, I think I will remove the incus and place a prosthesis directly from tympanic membrane to footplate, but I need to see if I have access to the footplate there. Okay. Okay, try to do that. Alors, donnez-moi la désarticulation. Oh, I will remove the incus and then put a TORP with, if I can, Silastic, but it's going to be tricky because I have very bad access to the stapes tendon. So, okay, now I can remove the incus if I can, or cut it. Crochet out. I don't think I can remove the incus like this, so I just need to push the incus because I don't think I can dislocate it properly. You see, there's no way I can remove it. It's too small. So let me see. Donnez-moi le nipper, s'il vous plaît. I will cut the long process of the incus and push the body of the incus superiorly, but even I can don't do it. I don't think so. I have access to this. Non, je peux pas. Donc donnez-moi le cannelé. All right, I will leave it inside the middle ear, trying to push the whole incus in a different way so that I won't have any trouble to place the prosthesis. As I want to go. Now I nipper encore. Je vais essayer de passer le nipper quand même encore pour voir. Nipper, Malleus nipper s'il vous plaît. If I could cut it, that would be great, but the problem is that I don't even place it. Crochet à son corps. All I need is to reduce the length of this lenticular process. There we go. I think I've already put it in the attic, so which is much better now. Okay, I can leave it like this. Let me see with the nipper pour voir s'il peut passer là maintenant. Je pense pas, mais on sait jamais. I cannot place it inside the nipper because the nipper is too big for the case. Non, je peux pas. Canner. Impossible. C'est dommage parce que ça me gêne là. Faites-moi le cadenet s'il vous plaît. Oui, le cadenet. I just need to check if I leave it, because I can use it just like a malleus if necessary, if I leave it like this. Because you see how it's lateralized. The reason for the large conductive hearing loss in this case is the fact that there is no connection between the malleus and the tympanic membrane, which is reduced in size also. So I will try to place this prosthesis here. I don't know if I can use the incus right in the middle of the field. Donnez-moi le cadenet encore. I cannot push it, just ouais, on peut essayer, mais elle va partir là, je pense. J'attendrai que ça fonctionne. Donnez-moi le 6 pour voir. I think it's going to work a little bit. Yes, this will help me. Very strong one, in fact. Ouais, ça marche. This trick was given by Céline. Good trick. Donnez-moi la 8 maintenant, s'il vous plaît. Fine. Good. Much better now. All right. Donnez-moi le cadenet, s'il vous plaît. Now the problem will be to place the prosthesis within such a small gap. But now I have access to the whole field. And the incus is not anymore in the field, which is good. The stapes is very mobile, as you can see. Donnez-moi le 3 de chouk et la 9. Well, I don't want to cut the stapes tendon. Now I will use a prosthesis, but I need to determine the length, which is going to be tricky. Cannelé, s'il vous plaît. Mets-moi les ciseaux. I have some adherence here from the connected to the stapes head. Okay, that's fine. 3 de chouk. Okay, so now it's done. Alors, donnez-moi le mesureur. Je vais essayer de déterminer cette longueur là. It's going to be difficult to determine the length because I need to determine it from the tympanic membrane, but it's very tricky. Non, le long. On va essayer avec le long, je pense d'abord. So the footplate is there. I don't see the distal tip, but I know that when I'm going to touch the footplate, the stapes will move. Yeah, now I'm at 0. I think it's 6 or 7. Will take a little bit of time to determine the right length. Because you see the position of the tympanic membrane is very, very distal, very proximal, I would say. But this is the position. The head of the prosthesis should be there. If I want to have any contact with the tympanic membrane, which means that yeah, I think it's 7. I will try 7 and see if I can reduce it. Mesureur encore, but I think 7 should be the right length. I think. Yeah, 7 will be fine. That's it. Plafond, s'il vous plaît. Okay. Now the problem will be to introduce the prosthesis. I may have to drill out the prosthesis to have better access, to reduce the size. Alors, on va la couper, puis je la taillerai. J'affraiserai la tête, hein? Okay, so we will use this prosthesis now. Okay, so I will want a 7mm long prosthesis. I will cut it at 6, push it at 6 first. To put it back at 7. Okay. Okay, right. So and of course we have the band because here we don't have any more malleus, so the only way is to attach the prosthesis to the stapes. Pass. Ah, on donne une autre. We have a problem with the band, which was not good. Il y a un petit défaut sur une autre. Okay, back to 6, pull back to 7. Okay, good. Now let's see if I can push the band a little bit lower, because I think the band is a little bit too high. I think it's better now. Yeah, that should be better. But of course I need to drill out now the prosthesis head. It's too big for the case, so I need to reduce the size. Ouais, la fraise à 8. Alors là par contre il me faut de l'eau. Hein. Il me faut de l'eau là, d'accord? Allez-y. Bon, même je pense que je vais prendre la 10 là. Hein?
C'est la 8.
Oui, même il faut la 10 là. So the beauty with hydroxyl apatite is that it can be worked. You can work on it, just like working on a bone. Okay, let's try like this. Ok, attendez, je vais le remettre sur la plaque là. Ok. Inspiration à 9, s'il vous plaît. Non, c'est un peu bouché, je pense. Calmez. Peut-être en déclive encore un peu, s'il vous plaît. Stop. Ok. Plein rond. Un 7, s'il vous plaît. Okay, so we're going to try to place the prosthesis right now. I need to place the distal tip of the shoe first and see how I can attach it to the prosthesis to the stapes. All right. Mettez-moi un 12 alors là. You see that I had to reduce the size of the prosthesis because you can see pretty big even now. Goes fine. Un 9 s'il vous plaît maintenant. Un 7 même parce que sinon je ne verrai pas. So I think the shaft is good. Calmez. Yeah, shaft is good. Well, so let's see if I can use now the band. 3 de chouk. That would be really great if I could use it. All right, goes down. Very tricky. It's a question of time. Calmez, s'il vous plaît. So I will put the shaft back, but first I need to attach with the band. Trois de chouk. Pardon, le canet d'abord. I'll need to reposition the distal tip. I think we're very close to make it. I think now it's better. You see they are moving together, so it's pretty good. But now I need to know if by repositioning the tympanomeatal flap the prosthesis will stay in this position. Let's see. Yes, definitely good. You see the good contact with the tympanic membrane, so it's very good. I'm happy about that, and I think it's gonna be good. Alright, so now I need to place the marrow cell, which I need to cut. Vous l'avez coupé? Oui, c'est bon. Very small. Allez-y. And that's it. Cannez, s'il vous plaît. All right. Attendez. Fine. I think it is a very special case. Pretty long, but of course you are completely free to accelerate or not the procedure, the video, but I think it was good to show you the entire procedure, and it's up to you to select the parts you want to check. Thanks very much for watching, and see you again soon. Bye bye.